Hi, my name is Dr. Bill Polonsky. I'm a clinical psychologist and a certified diabetes educator. I'm here to talk about blood glucose monitoring and some of the issues that our patients face and what we can do about it. First, I want to mention a study we just conducted recently where we looked at 800 folks with diabetes who told us that many of them were really having a tough time checking their blood sugars as often as really they need to do, or doing anything really useful with that blood glucose information. And in our study, we found there were three major reasons that were contributing to this problem. One was people saw blood glucose monitoring, or many of these patients saw blood glucose monitoring as just a drag. It was just burdensome. For many folks, another important reason is they saw the numbers on their meter as just, well, pointless. They didn't understand what these numbers meant. They didn't really know what to do with this information. No one else seemed to be looking at this information with them, so why bother? And the third factor we saw is that for many folks, these numbers were discouraging. They were demotivating. They felt like there was nothing they could do with these numbers anyway, and when they had tried, it didn't really work. And so it was understandable that when you put all this together, so many people felt like, well, why should they bother? And weren't checking very much or actually checking blood sugars at all. So when we think about what to do, the important messages we want to share with folks with diabetes is, number one, that, you know what, checking blood sugars is really important. If you want to get on track and stay on track with your diabetes, make sure with your physician you have a clear plan for how to be tracking blood sugars, how often to check, and what to do with that information. Now, we also know there's new technology and new tools that can help make this easier and more productive for folks and can address some of these important emotional issues that we found in our studies. And one of the new tools is the One-Touch Vario blood glucose monitoring system. It's a nice meter that has some cool features. For example, one of the things, it has this color-coded range indicator. So when you check your blood sugar, rather than just seeing a number, it has a special color attached to it. So it helps people to know whether their numbers are actually in range or a little low or a little high. And that's really helpful, especially for the more than 1/3 of folks with diabetes who tell us that, you know, they're really confused about their numbers and not sure what they mean. Now, an important other feature that we see on this new meter is that it brings all the blood glucose numbers, the data together over time, automatically without any extra work on the part of the patient, and provides positive feedback to let you know that, hey, you know, your numbers have been in range over the past couple days. Or, well, maybe they were out of range, but now they're moving into range. And if there's one thing we know that our patients need and that we need, especially when you're dealing with tough behaviors like, well, checking blood sugars over time, it's congratulations, it's positive feedback. And when we get that, it just makes it easier for folks. People feel more engaged and feel more motivated. So in addition, we want people to know that in general, please stay educated about diabetes. Seek out information to help you be as educated as you can be about what diabetes is and what you can do to make a big difference to help yourself stay healthy with diabetes. Also, in terms of the emotional element, we ask people to please, if at all possible, think about steps you can take so that you don't have to do diabetes alone. You know, when you got people in your life who are rooting for you and care about you and understand, it's just a lot easier to keep things going. So that means having a healthcare professional who you feel you can trust, who you feel is on your side. And it means turning to family and friends, maybe an online community or support group, people you can talk to when you start losing your oomph around managing diabetes. And if you want more information about the One-Touch Vario meter or about diabetes in general, I encourage you to go to onetouch.com. And if you're especially interested in the emotional side of diabetes, which really doesn't get talked about too much, I encourage you to visit our website, the Behavioral Diabetes Institute, at behavioraldiabetes.org. And I sure hope this information will be useful for you.